Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, this is Danielle, Eytan, a facial plastic surgeon at NYU Langone Health in New York, and I'm here with Manuela von Sneidern, our first author on the paper Characterizing the Online Discourse on Facial Paralysis, What Patients Are Asking and Where They Find Answers. Today we'll talk a little bit about this study and our results and what it means going forward. The idea for this study really came about from our clinical practice. Like anyone that sees patients for facial paralysis, I began seeing a lot of patients coming in with information they had found online, and it really varied in quality and rigor of what they were searching. So patients frequently come in calling every kind of facial paralysis Bell's palsy, having a lot of different questions to me as well about treatment, etiology, and questions about whether or not what they found online was true. In particular, we've had a number of instances in the last few years where facial paralysis was in pop culture references. So we saw kind of spikes in this around the time of the COVID vaccine, around the time of certain pop culture icons whenever there's a case of Bell's palsy, such as with Justin Bieber and other celebrities. Many patients hear about facial paralysis, Ramsay Hunt, Bell's palsy for their very first time. And so we became curious about what kind of information is really out there, what are people asking, and where are they getting their answers. And so we designed this study to look at that and to be able to understand it in the hopes of creating better resources for patients down the road.
So we really began the study by looking at Google search trends, which gave us kind of a reflection of the searches that people are making on Google every single day. And we looked at this data in order to find which search terms people were physically putting into the search engine bar when they were looking for facial paralysis information online. So what terms were they typing? We then, once we found these terms, we looked at the people also ask questions that were on Google to find which specific queries people were asking that contained these search terms, and we found out which websites people were going to answer these questions. Overall, we found that Bell's palsy was a much more commonly searched term, with search volumes that were at least 8 times as high as those of facial paralysis. We also found that etiology and treatment questions were the most popular. When people were looking for answers to these questions, they usually went on search engine response pages and were more exposed to websites that came from private medical groups as opposed to those that are associated with academic institutions, even though the ones that are associated with academic institutions are much more numerous. And that was kind of a surprising result, only because the amount of information available on these sites is much greater, but it doesn't have as much visibility and isn't as accessible to patients.
Yeah, we really were kind of surprised at how low-ranking some of these academic websites were. And, we hope that this study can give us information that helps us as surgeons that treat facial paralysis create better content for patients out there. Patients are always looking before they come into the office and shaping their opinions. And I think having some more neutral information out there, academic websites with good quality and good patient access will improve patients' understanding and help guide them when they come in for counseling as well.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.